Hello, everyone. Good evening. Welcome to the Connecticut Psychological Association's Mental Health Awareness Month outreach event. We're so happy to have you with us this evening. Thank you for joining us. And just so everybody knows that our materials will be available on our website, on our YouTube page, and our social media after the event this evening. So no need to take notes. We'll provide you with everything that you need. Welcome. We're so happy to have you here tonight. My name is Dr. Jennifer Doran. I'm the current president of the Connecticut Psychological Association. My day job, I work at the VA doing PTSD and trauma care for our veterans, and I have an academic appointment in the Yale School of Medicine. If you have any questions or feedback about our event tonight or want to reach out, you can reach us at info@conpsych.org. And if you'd like to stay up to date on everything related to mental health and psychology and what our organization is doing, our social media links are here as well for you. So you're with our public education team tonight. CPA, Connecticut Psych, is a professional organization dedicated to advancing psychology and using psychological science to inform policy, solve problems that we have in our society, and promote legislation and advocate. We are very invested in promoting human welfare and advocating for pro-mental health policies and actions on both the state and federal levels. There's a list of things that we do here, and more information is available on our website. Just a few quick announcements. So everybody is welcome tonight. Participant names are not visible, so being here is confidential. No one can see your names. If you register, you'll get an email with a link to the slides and materials after. You don't have to do that. Everything will also be available on our website and accessible after the event. Everybody is muted. If you would like to ask a question, we have a chat feature. You're free to use it. We also have a Q&A feature that you can use in Zoom, and we will track that and answer either in the moment or at the end of the event when we have a Q&A section. And again, materials will be sent and available to everyone afterwards. So just a quick disclaimer, the information that we're providing is informational, it's just general informational in nature. So nothing that we're going to say tonight replaces a professional consultation or evaluation, and isn't, sort of professional advice that you would get if you were meeting one-on-one with a psychologist. So if you have any concerns about yourself, about anybody in your family, loved ones, to please, please, please consult with a qualified licensed mental health professional. And again, this is just kind of general informational things here. If you need immediate assistance, if you're experiencing a mental health crisis or you know somebody who is, there is a Connecticut mental health helpline. You can dial 211 and then press 1 to get that. And of course, we have a national suicide prevention hotline as well, should that be needed at any point. So before I talk about the different presenters and the topics that we're going to cover this evening, I just want to acknowledge that we are here with a heavy heart tonight. As everyone knows, there was unfortunately a mass shooting that occurred in a Texas school just yesterday. It's affecting us. I know it's weighing heavily on all of us here tonight, as it may be all of you. Stressful times, anxiety-provoking times. This school shooting comes on the heels of a racially motivated shooting that just happened in Buffalo, New York, a couple of weeks ago. So many tragedies continue to happen around us that are stressful and can cause things like depression and worry, anxiety, fear. So we encourage everybody to take care of yourselves, especially during our discussion this evening, and just want to dedicate the presentation that we're giving for Mental Health Awareness Month to the victims of those tragedies. So our hearts are with you. We are thinking about you and just wanted to kind of acknowledge the context that we're giving this talk in tonight. So we are going to be talking about the mental health impact of current events, things that we are dealing with and experiencing, symptoms of some very common mental health conditions, domestic violence, some information on suicide prevention, how to talk to people, what to look out for, some basic tips and strategies, how to take care of yourself, how to feel good, how to feel better. So a little self-care, mood boosting section. And then the end of our presentation has many, many resources available for where to find help, how to get access to a provider if you need one, tons of websites with resources. So we will go through all that at the end. And again, that will be available for you afterwards. We have a very distinguished panel with us tonight. I'm thrilled to have Dr. Shiva Rezvan, who works at Comprehensive Neuropsychological Services, is a professor at Albertus Magnus College, and is the co-chair of CPA's Social Justice Committee. Dr. Elaine Ducharme, who works in private practice and is CPA's public education coordinator. Dr. Kathleen Chapman, she is co-chair of the work group of the Connecticut Suicide Advisory Board, works at DEMIS as a clinical manager, and is the committee chair for CPA's public education group. And Dr. Elizabeth Rathbun, who also is in private practice, is on the CPA board of directors, our liaison to our national organization, an assistant clinical professor at the Yale School of Medicine, and a certified eating disorder specialist. So we have a wide range of expertise on the call with us this evening, and you'll hear a little bit from everybody about the different topics that we discussed. It is Mental Health Awareness Month. Mental health matters. That is a take-home point for sure, and we're so glad that all of you are here getting this information this evening. Dr. Rezvan, I'm going to pass it over to you. You're on mute, Shiva.
Thank you so much, Dr. Doran, for the information you provided for us. And also, hello, everyone. Thank you for being here tonight. Tonight, I'm going to talk about mental health and its relationship with the current events. So as Dr. Doran mentioned in her talk, with heavy heart, I just say that, on May 14, we had a Buffalo shooting. And then yesterday we had the shooting at the elementary school in Texas. So if we want or don't want it, it will impact us. And in addition to all of those, since 2020, we have been dealing with pandemics that also has impacted us. And we are going to cover very briefly all of those. So according to the American Psychological Association, annual survey that was conducted by Paul Harris, the results of the survey has found that although U.S. adults retain a positive viewpoint, the people are struggling on a daily basis with daily tasks and decision makings in so many areas, including safety, security, growth, travel, and work. Next slide, please. And then many of us feel the need for constant risk assessment. You might have found yourself asking questions like, what is the community transmission in my area today, and how will this affect my choices? What is the vaccination rate? Is there a mask mandate here? And very unfortunately, pandemic stress among people of color, including Black and Hispanic adults, is elevated. The pandemic has had a substantial negative impact on marginalized communities. Next slide, please. According to the Centers for Disease Control and Intervention, we have had increase in the rate of anxiety and depressive symptoms. In addition to those, there are other sources of stress, including healthcare problems, mass shooting that we just talked about, gun violence, climate change, suicide rate, immigration issues, sexual harassment, discrimination, and identity-based violence, the opioid epidemic, and increased financial strain. Next slide, please. Also, we are dealing with the socio-political climate, including being exposed to chronic isms, including racism and sexism, increased and pervasive race-based discrimination and violence, political divisiveness, and exposure to harmful and toxic social media. We have seen that Russia has invaded Ukraine, And also, we are dealing with economical problems and inflation rate. Next slide, please. So, regarding the impact of war, Dr. Steve Sogden, who has served the U.S. Army for several years and is a psychiatrist and knows firsthand what it is like to be on the battlefield and is an expert on how trauma can affect our mental health. He says, quote unquote, civilians, soldiers, and those consuming the war through social media can develop the typical psychological profile of trauma. Watching the events across Ukraine and other parts of the world allows people to empathize and gets inspired and help. But on the other hand, increased screen time of traumatic content comes at a cost. An interesting study was conducted after 9/11, and the results show that those who watched the event on television were just as likely, if not more, to develop trauma-like symptoms than those who lived in New York City at the time. Next slide, please. And the last but not the least, for parents. All those stresses have had impact on children and adolescents. The research has found that there has been marked increase for depression and anxiety, substance use, and acts of intentional self-harm. Parents have this important responsibility to check in with their children on a regular basis and be aware of common warning signs of symptoms. Also, I would like to share this with you. You are going to have these slides after this, that National Association of School Psychologists have some information about how to talk with children about violence. So you might find those information, and you see the link at the bottom of this slide. Next slide, please. So being aware of common mental health is important. I'm going to share with you a few mental health issues together with a couple of symptoms. Next slide, please. Before that, I would like to mention that there are many different types of depression and anxiety and other conditions and mental illness that may present themselves differently among different adults, children, adolescents. So these symptoms that we cover here are not comprehensive and should not be used to make a mental health diagnosis. Only a qualified licensed mental health professional can diagnose a mental health condition, and if you're concerned about yourself or someone else, please recommend a mental health consultation with a professional. So the first symptom we are going to cover tonight is depression. That there might be low or depressed mood or angry, irritable mood most days, loss of interest and pleasure, and changes in sleep and appetite. Next slide, please. We might see anxiety symptoms that might include worrisome thoughts most days that is difficult to control, and it might cause some tired, fatigue feelings, restlessness. Next slide, please. Panic disorders that might present itself through physical and psychological symptoms. Physical symptoms might include increased heart rate, sweating, psychomotor agitation. Psychological symptoms might include fear of losing control or going crazy, and those might cause avoidant behaviors. Next slide, please. Obsessive compulsive disorder that might present itself via obsessions and or compulsions. Obsessions might be recurring thoughts that are unwanted or upsetting. Compulsions might be repeated behaviors like cleaning or internal acts, and those might impact functions on a daily basis. Next slide, please. Eating disorders that might include restricting and or refusing food intake, recurrent binge eating with or without behavior to compensate for calorie intake. And then there might be shame and guilt after binge eating. Next slide, please. Alcohol and substance use disorder. Drinking on a regular basis or using more than you meant to, difficulty controlling or cutting down alcohol or substance use, or strong craving to drink or use substances. Next slide, please. And trauma or post-traumatic stress disorder that include exposure to traumatic event like death, threat of harm, serious injury, sexual violence, and re-experiencing the events, including nightmares, flashbacks, intrusive memories. So I would just like to let you know that we are all together in this. And there are mental health professionals out there to help. So at this time, I'm going to turn it over to my colleague, Dr. Lenny Ducharme, to provide you with additional information. Thank you.
Thank you, Shiva. It's really a pleasure to be here. And again, I just want to offer my thoughts and prayers to all of the families that were impacted in Uvalde, Texas. And so as we talk about intimate partner violence and domestic violence tonight, we can really keep a focus on how do we manage to avoid violence and where we're going to go from here. So next slide, please. Thank you. So domestic violence is a pattern of abusive behavior in intimate relationships, and it's about domination. It's about power and control. It can be physical, sexually, or coercive in nature. It's generally not a single event. It can be. It can happen just once, and people can move on if they deal with it, but generally it escalates. It doesn't generally get better. And treatment for intimate partner violence is different than regular anger management. Next slide. So I have here the wheel of power and control. I know it's a little bit hard to read, but it's important, and you'll have this in your packet, to think about violence and intimate partner violence in a variety of ways, because a lot of people think of it as simply physical violence and they're embarrassed. They think, well, it wasn't really anything. You know, he just wasn't nice, or wouldn't give me money, or wouldn't let me work, rather than, you know, I wasn't hit. I don't have any bruises, so how could this be a problem? And so it's really important to understand the different ways that people have power and control over us. And it's emotional abuse. It's all of these different things, using the kids against us, using male privilege, because generally speaking, domestic violence occurs more by men towards women. So I'm not going to go through all of these slides, you know, all of these short pieces, but please look at it and understand that domestic violence is not just about that physical violence. Next slide. So some of the facts that are important here are, on the average, I think this is incredible, 24 people every minute are victims of rape, physical violence, or stalking by an intimate partner in the United States. That's more than 12 million men and women every single year. One of the most important things on this slide is that witnessing violence between your parents or caretakers is like the strongest risk for transmitting the violent behavior in the future. I want to call attention to this next line that says adverse childhood experiences. We often call those ACEs, and they were ignored for a long time. But what they mean is children being exposed to these kinds of adverse childhood experiences. And it can be, you know, sometimes even things like family members, you know, becoming very ill and dying, but certainly any kind of violence, and even the children in Texas that were not killed, but that witnessed these events. The problem is that we tend to think of it just as, okay, there's a trauma that's happening now. But when kids have these experiences, these adverse childhood experiences early in life, many times if they don't get help for them and they're not treated, they carry on into using poor coping mechanisms as they get older. And when they use poor coping mechanisms, things like using drugs, alcohol, smoking, those can lead to actual physical symptoms later in life. So it's very, very important. And I've had to testify in court and help judges understand that even if the kids weren't being abused in a domestic violence situation, they are being impacted. And it's very, very important to understand that. Boys who witness domestic violence are twice as likely to abuse their own partners and children. And the cost is $37 billion a year to treat this. All of the people, I mean, the numbers of homicides and medically treated injuries because of this is just enormous. So this slide, I think of all the things I'm talking about tonight, is one of the most important because it's about judgment. We really need to consider that there are so many reasons why women don't leave. And I use the word women because generally speaking, as I said, it's more often women, though certainly there are men who have been abused. But we often will say, well, why don't you just get out? Why don't you just leave? Well, there are a lot of reasons, and one of the greatest is that if women do leave and don't have a safety plan, they are at increased risk for additional harm or being killed for up to 2 years after they leave that relationship. Because when the abuser loses control, when you're no longer there, it can really ramp up the rage and the anger. So that is one of the reasons. It's a safety reason. And I will share that years ago, many years ago, when none of us knew much about domestic violence, I did tell someone to get out. I thought they really needed to leave. And they did, and their husband found them, and they were really beaten badly. And this was long before any of the real research was being done. It was in the 70s and when we were just starting. So I learned the hard way, but I'm hoping that we are teaching and helping people understand that you cannot make that judgment. Women don't leave because they hope things will get better. They don't realize that the violence is going to escalate. They hope it's going to get better. If I just remember to serve breakfast on time, or if I just have dinner on the table. So then they do that. And the next day they come home and the person says, well, I didn't want dinner right away. You know, I wanted to take a shower first. So there are all these mixed messages, and you can't change that. You have to take care of yourself and not think that you're going to be able to change that other person or control it. Many individuals just don't have the financial means to leave. They don't have the psychological resources to leave at that time. And many really believe that if they stay and they keep the family intact, it will be better for their children, because they don't understand what I was just talking about on the previous slide, those ACEs. And those are really critical. So telling someone to leave or asking why they haven't left is judgmental and dangerous. And really, you need to have a safety plan in place, and we're going to talk about that in a second. But understanding that if you're in a situation where there is intimate partner violence, domestic violence, marital therapy is not the way to go. The person has to get help. They have to be willing to understand that they want help, that they need help, and get help for their own domestic violence and rage and anger management on their own, and that you need to figure out how to stay safe. Next slide. So it's really important to know that anger is okay. I don't know about all of you, but I was certainly angry when I first heard about these shootings. We all get angry. We get angry about, what do we get? We're supposed to wear a mask, or what are we supposed to do? We don't know all of these things that, that Shiva was talking about a little earlier. We get angry. That's okay. But aggression is not okay. So we have to figure out a way to help people understand that aggression can be verbal, emotional, physical, or sexual, but the only one that's really okay are using your anger to verbalize what you're feeling. Conflict is normal. We're going to have it in intimate relationships. We're always going to have conflict. We're going to have conflict at jobs. It's in some ways it makes the best for, it helps us problem solve. If we never had a conflict, we'd never move forward. So we have to recognize our feelings and find ways to deal with them without violence. It is so important to remember that abusive behavior is just not normal. It shouldn't be expected. You shouldn't feel like you deserved it. You've done nothing to deserve being abused. Next slide. Okay, so we have here a long list of red flags of abusers. And looking through them, I think a couple of things that I want to highlight. The first one is jealousy and violation of boundaries. So we all use our text messages, right? And we send things. And sometimes I wonder if the text messaging was one of the worst things that ever happened to our society, because people put things in text messages and that really shouldn't be there. The numbers of marital conflicts that happen because people aren't trusting, and they grab each other's phones and they read text messages and they find, messages from lovers or various other things that indicate an affair, or they find nothing, but your sense of boundaries is definitely being violated. So please understand that nobody has the right to just take your things and read them. It's not a matter of whether you have something to hide or not. Understanding that people are, if they're tracking your where you're going, it's one thing if you all have families today know where their kids are on their phones, they can follow them. If you've all agreed in the family that that's okay and you want to know where each other is, where you are, that's fine. But if you discover that your spouse has put a tracking device on your car, your phone, that's a real red flag of abuse. I want to slide down to, obviously history of battering and threats of violence, weapons in the home. But also something that isn't in here is something called gaslighting. In the last couple of years, I am hearing people tell me so often, I feel like I have been gaslit. And what that means is that your partner is telling you that something you've experienced isn't true, that you said, you were really angry last night. I was not. And it begins to make you feel crazy. And I think that crazy making feeling is just very, very scary. And after a while, if somebody starts losing their self-confidence, they begin to believe that it is all of their fault and then really lose any ability to feel like they can stay safe and get out should they need to. Next slide. So what can you do if you're in one of these situations? First of all, it is really important to know that this is not your fault and that you want to talk to somebody who's been trained in treating intimate partner violence. If you're thinking of leaving, you really need to have a safety plan. So one of the things, as I've said previously, is understand you can't change your partner, but you do have a choice of how you respond. So I want to stress this because if you're in a situation where if you change your response by not getting sucked in, by not responding in a reactive way, your partner might actually back off because they aren't engaging you. And so they may actually settle down. On the other hand, it might really make them angry that you aren't responding. So you have to understand that. So I can't tell somebody a blanket piece of advice, don't respond and it'll be okay, because I don't know that. You have to figure that out because you could be putting yourself at greater risk. During an argument, try to get to the place in the house that's the lowest risk. So you always want to be in a room that has an escape route. That means avoiding your kitchen, avoiding rooms that don't have an escape route, but also avoiding rooms that have weapons. So your bathroom, your kitchen, garage, there are often tools there that somebody can grab. And unfortunately, over the years, I've seen people be stabbed and killed, and you want to just try and avoid that whenever possible. As I said, be aware of escape routes, know where things are, the way you could get out. You want to keep keys accessible so that you could get away. And that may mean that you have to keep an extra set with a friend or a neighbor, because a lot of times in these kinds of situations, your spouse might take your keys and try and keep you from leaving. Let your neighbors know. Do not be embarrassed. This is nothing to be ashamed of. It's something that it's a public health crisis and we need to resolve it. We need to figure it out. So if you're being hurt, let your neighbor know what to watch for and let them know to call the police. Teach your kids a special code word so that if they hear certain things going on or if something is happening, if you say a word, make sure it's a word that you wouldn't normally say, something like ishkabibble, that they know to call 911. Next slide. I know I'm going quickly through this and we can spend a lot of time, but hopefully you'll have this to read and you can go through it carefully yourself. Know where you would go. Where a domestic violence shelter is, or see if you have a friend that would allow you to come to their house. Understand that sometimes you may have to give in. If your spouse is telling you, you must do this, if you think it's going to be dangerous to not do that, you might need to follow whatever it is that they say, just to wait until the abuser has settled down or gone to sleep in order to keep yourself safe. Keep copies of any major documents, passports, birth certificates, anything else, proof of citizenship. Keep a copy of those and then give a copy of those things to a friend or a family member, because those may be what you really need to stay safe in the future. Having your own savings account can be very helpful, but you want to make sure that if you're trying to keep that secret, that you have it at a separate bank and statements don't come to your house. Understand and know that you have know where you have the domestic violence hotline, know the text number here so that you can text that in case of an emergency rather than having to use a phone. And even if if your spouse has moved out, changing the locks, installing a security system or lights that go on if somebody comes close to your house can be extremely helpful and important and help you feel safe as well. Have things like rope ladders available. People often forget that from the second floor, how would you get out? And as you look down this list, if somebody keeps calling you, just screen your call. So know not to answer. There's another one: avoid having alcohol if things are if you're around the battery. You want to keep your head, make sure that you're not feeling out of control. And obviously, if you're feeling that any of these things apply to you, please seek help from a psychologist or other mental health professional that can help you figure out how to stay safe and how to take care of yourself and your children. Remember, you may not have to leave right away, but it is your response, and you may never have to leave, but it is your responsibility to provide for the safety of your kids and to figure out how to keep yourself safe, even if you're staying. And be aware that there certainly are groups for domestic violence that can be extremely supportive. I think next slide. We just have here a list for you of the various hotlines and ways to stay safe. We have some very good resources in Connecticut. So please, please, please reach out, and thank you. And I believe at this time, I'm going to turn this over to Dr. Elizabeth Rathbun. No, excuse me, it's to Dr. Kathy Chapman, who is going to talk about suicide prevention. Thank you, Kathy.
Thank you, Dr. Ducharme, and thank you everyone for attending. We're going to be talking about suicide prevention, just to learn about risk factors, warning signs, to help us to know when to start a conversation with someone about what's going on with them and to understand how we can help. It's such an important topic. Next slide, please. Just an overview that suicide is a very complex, very personal issue. We're going to be talking about general information that I hope will be helpful, and I hope will give you ideas just in general how to talk to someone who might be having a hard time and to increase understanding. And we just hope that if you feel like you need to take a break or take a minute for yourself as we're talking about that, please do so. I know sometimes this can be difficult to hear or think about. And of course, always reach out to a licensed mental health professional if you'd like to learn more or talk more about this, or if there's someone that you're concerned about, or if you've even been having some thoughts yourself. So as we know, suicide is a public health issue. It's a leading cause of death and has increased since 1999. And has certainly been an issue for all age groups. Next slide, please. I'm including this to try to take a minute to just understand, how does this happen? What would lead someone to start thinking about hurting themselves? And as I mentioned, it is a complex issue. And we're going to talk a minute about risk factors. And risk factors can fall into different categories that we'll look at a little bit more in a second. Biological, like someone has a chronic illness; psychological factors, someone's dealing with depression, anxiety, or those adverse childhood events that Dr. Ducharme was mentioning. Environmental factors, another issue. Someone may be living in an unsafe situation that's very stressful. They also may be living in a situation where there's a lot of means available to them that in the moment when they are feeling extra stress and thinking about suicide, they may impulsively use a method that's available. And social factors. We know that events like losing a job, an end of a relationship, getting arrested, those are all risk factors. And no single risk factor can predict suicide. Things interact with each other on top of what might be happening in someone's life at that moment. So someone may have a history of adverse childhood events. They grew up in a very stressful environment as a child, maybe haven't developed a lot of coping strategies, maybe dealing with some depression and anxiety. On top of that, you may have just learned that they are diagnosed with a physical illness. And then on top of that, their relationship breaks up, or they have a fight with their partner, or they get criticized on the job. We know that these things can make someone prone to having thoughts of suicide. What increases the risk of suicide is then access to the ability to make a suicide attempt, access to lethal means. That could be a gun or other weapon. Next slide, please. So basically, when someone has a lot of risk factors, it gives us an idea that someone is having a tough time, but it does not in and of itself explain or predict suicide. It's just information to let you know that someone might be having a tough time and it's a good time to reach out. So here are some of those biological risk factors that I talked about: ongoing physical pain, ongoing illness, just getting a new diagnosis, say, for example, for heart disease, central nervous system disorders. Social risk factors, a big one is feeling a lack of belonging, that lack of connectedness. Someone maybe who's being bullied, being ostracized, doesn't feel that they have many friends, don't feel like they matter at work. They may be having relationship difficulties, maybe feeling, most importantly, like they're a burden to others. So these are very important risk factors to understand, that feeling a lack of belonging, feeling like someone is a burden. Someone might make a comment like, well, you know, you'd be better off without me, or, you know, I won't be around much longer to bother you. Psychological risk factors include a sense of emotional pain, and that those issues that we've talked about earlier in this presentation, and depression, anxiety, those kinds of things, hopelessness, these all also contribute to possibly increasing thoughts of suicide. And then social isolation, which is so prevalent now. Even though COVID's gotten better, people have still been disconnected for several years because of COVID. And there's still a lot of restrictions, as well as I mentioned, those access to lethal means. Next slide, please. So there's also protective factors that are really helpful when we're dealing with any kind of challenge in our lives, including those risk factors. It helps us to develop coping skills and resilience, which we're going to hear more about in this presentation. So some examples are ability to cope with stress, spirituality, connecting to something that inspires us. And that might be, you know, a spiritual leader, someone we look up to in our lives. Hope. These are all important internal risk factors. And as we're dealing with the recent events on the news, with the shootings lately, these are things that can help us. External protective factors that increase resilience or connection with others. Really anything that gives us a sense of connection, a purpose in our lives, connection with family, pets, relationships. It can also be work, a project, you know, a cause. These are all things that promote feelings of connection. So important in our lives to include those. And those could have been disrupted because of COVID. So recognize that in our own lives. And then if you know someone who seems isolated, it can be helpful to reach out to those people, you know, include them in maybe an activity, a walk, your book club, some other way of connecting with them. Next slide, please. So warning signs. Warning signs are a little bit different. Warning signs let us know that someone could be at immediate risk and definitely need someone to help, reach out to help them, or if you may be experiencing any of these, it's a time to ask for help. Warning signs are very individual, but some of them can be change in behavior related to life events. You know, someone is isolating more, maybe after a breakup, talking about not being around, even joking about suicide. So someone is researching methods, talking about feeling trapped, talking about unbearable pain. Increase in alcohol and drug use shows that someone is having difficulty, could show that someone's having difficulty with coping. So something to be aware of if you see that change in behavior, and even if you sense that something just isn't right, something is different for someone, that's a good time to reach out. Next slide, please. So here are some of those warning signs we just talked about. They can be quite clear and direct. Someone saying that they do intend to die by suicide. Next slide, please. Or indirect. I'm tired of my life. I just can't go on. People will be better off without me. With children, they might ask about dying and going to heaven. They might make comments about, would you, if I die, would you miss me? Or I bet no one would miss me if I die. So those are some of the indirect statements that someone might make, including joking about suicide. Next slide, please. So we know for children and adolescents, overall mental health issues increase risk. And those mental health issues cover a wide variety of areas and of course are connected to those adverse childhood events. Children and adolescents are at a different stage of cognitive development than adults are. They don't have the same perspective of seeing that things will change, that things will get better. They may not realize that things will get better and not have that hope. Research has shown about a third of children and adolescents talked about suicide prior to a suicide attempt. And again, making statements, I wish I was dead, I won't be a problem to you much longer. And just really emphasizing that access to lethal means, having a gun around or other weapons can really increase risk. So important to have an atmosphere where it's okay to talk about stress. It's okay to talk about negative thoughts, feeling bad, feeling bullied, to talk about suicide, to be able to feel free to share with someone an individual's having thoughts of suicide. And you see this example just asking, how are you? Someone says, fine. Well, actually, yeah, that's a socially appropriate thing to say fine, but they may be feeling a lot of other things. Next slide, please. So here's an example of some, well-known people who did die by suicide and seemed to have so much going for them. Next slide, please. So this is a really great way to visualize how to reach out with someone. First step, this is from the National Institute of Mental Health, which has, if you want to go on to their website, they have a lot of really good resources on suicide. So asking someone, for a child, is there too big of a problem to handle? And asking them directly, are you thinking of killing yourself? First of all, it makes it okay to actually talk honestly and be open about it if we actually mention it. And sometimes just saying, well, you're not going to do something crazy, are you? Well, that the natural answer is, well, no, of course not. So you want to create an atmosphere where someone feels comfortable to talk. You want to be aware of the environment. If someone talks about having thoughts about suicide, just being aware of what's around for medication. What's in that room, as Dr. Ducharme mentioned, what's in the kitchen? There's knives around. Is there a weapon around? So just being aware of those things and staying with the person. Don't leave them. And listen carefully. Let them talk. Don't rush in to offer advice. And then help that person connect. And that may mean going with that person to their appointment, and maybe making that phone call for them, or staying with them while they make the phone call, and then follow up, staying connected. If someone has reached out to go to a therapist or is talking about having a hard time, stay connected with that person. What research has shown is a very effective method to reduce suicide is what's called caring contacts. That's just a note that says, hey, I've been thinking about you. How are you doing? I'd love to be in touch. That is a way to stay in connection with someone and makes that person feel like someone cares, someone's connected to them. And we know that connection is so important in resiliency and reducing risk for suicide. Next slide, please. And you're going to have this packet, so you'll be able to look at this information. So suicide risk is like a curve. It does not stay constant. We talked about those warning signs. That warning signs can let us know that someone's suicide risk is increasing. Maybe, again, someone had that criticism at work, or bullied at school, had a breakup, and they're starting to they're thinking maybe getting more negative, feeling more hopeless, more emotional pain, and starting to think about suicide. That person needs to get through that increased risk and in order to listen, to be able to feel more hope, get help, and that risk will go down. So important to know when someone is under stress, what may seem obvious as alternative and resources may not seem so obvious or available to them, and so helpful to be able to be with someone and support them as they access resources. And again, supporting their connection to help. Next slide, please. So just some basics on how to talk to someone who you're worried about, who you're concerned about. And this can be about suicide or anything that indicates that person is having some sort of crisis. And this can apply to anybody we're worried about, anybody that seems like they're not acting like themselves. Talk to them in private. Ask them directly, how are they doing? And are they thinking about suicide? And just listen to their explanation and their perspective and acknowledge that this is tough and that they're doing the best that they can. Don't minimize, don't debate the value of life. As I mentioned, stay with them, help them access treatment, and stay in touch after the crisis is over. Next slide, please. We talked about talking with children, is asking them if they're okay. Again, asking about suicide directly, and 211 in Connecticut provides crisis services for anybody, including children under age 18. Next slide, please. Here's some resources, so useful to contact. In Connecticut, we're so fortunate to have so many good resources, including crisis intervention, as well as many trained licensed mental health professionals, including a psychologist. There's a lot of real research that's been done on suicide prevention. There's a lot of specialized psychotherapy and psychopharmacology, brief intervention, which is helping people use their own coping strategies, helping them access those during times of stress, called the safety plan. And that's something, if you know someone who is being challenged by suicide, that you can help them out with that by being a source of support. For children, Connecticut has this really great resource. You'll see in your packet how to access this. This is a grant-funded resource through the state of Connecticut, Connecticut Suicide Advisory Board. And it's basically that safety plan that I just talked about, which is based on research designed for children. It's a children's guide to developing coping strategies, accessing those coping strategies through this really cool book, Gizmo's Possum Guide to Mental Health. Gizmo is an actual therapy dog. He's very tiny here in Connecticut. And each of the pages is illustrated by different therapy dogs. You can see this online. You can get a free copy. In Connecticut, we can get these copies free. Next slide, please. I just want to really quickly talk about firearm safety. If you go to the Connecticut Suicide Advisory Board site, preventsuicideCT.org, and I have all those links here, you can get all kinds of really helpful information on keeping your home safe, but room by room. And you can see some of those links on the right side. Anything that puts distance between an individual and a gun really helps, whether it's a locking device, keeping it in a locked cabinet, and just making sure that everyone is educated about firearm safety. If you're thinking about having a friend hold a gun, there's a really quick form that you need to fill out through the Connecticut State Police, and there's a website for that. Next slide, please. So medication safety, someone's at risk, that's do not keep that big bottle of Tylenol around that you might have bought at Costco or someplace else. Tylenol's one method of to try to die by suicide. Safe storage out of reach and out of sight. Make sure you're not keeping expired medications around. So just important again, and also important about what other methods might be around the house. Next slide, please. And here are some more resources targeted for example, veterans, and just general resources as well. And you'll have all this information on your packet, and on the Connecticut Psychological Association website has a list of resources. So please feel free to ask any questions, and I will hand this over to Dr. Rathbun.
Thank you so much, Dr. Chapman, for those important resources, and it's nice to be with you all tonight. I just want to briefly talk a little bit about how important it is to have a self-care routine and really make it actionable to help our mood and well-being, especially at these difficult times. So just a few things to kind of think about. There's a phrase that goes, move a muscle, change a thought. Really, sometimes we can get stuck in our head a lot. And so this is a really good one to think about. Sometimes we just need to do an action, whether it's washing the dishes or taking a shower, or stepping outside for a little walk, just doing something to get going, to maybe get out of our head if we are experiencing stress or anxiety, or we're in a lower mood. Also, increasing positive and pleasant activities. There's actually a way that we can change our brain and really rewire some of that old kind of stuff that gets stuck, like some of that thinking that can kind of really take us to some difficult places and kind of keep looping in our head. So there's the good news is that we can change that by doing things repeatedly that are more positive and more pleasant. So just kind of knowing yourself and what are those things. Instead of trying to take away things, which we try to do when we're not feeling good, right? It's actually been studied, and it's more effective to actually add things. So, something that you enjoy, whether it's gardening, whether it's reading, whether it's, playing with your dog, or anything, like any kind of activity, even if it's small. Some other examples to kind of build dopamine and serotonin, which are those mood boosters in our brain, are to, get outside, take in nature, have an experience that's positive with other people, where you're sharing something, where you're sharing an experience, being grateful, like really having gratitude for the things that you do have. So those simple things can really be powerful. Reaching out to others, staying connected. I know that's been really hard, obviously, in COVID, but there's ways to do it, and that's something that is really important. And also, how do you talk to yourself? Because the way you talk to yourself does matter. If you would not talk to other people the way you talk to yourself, then it's time to really look at and examine what's going on there, and really, think about shifting that and get curious around what's going on there, because it does make an impact. Trying to do one kind thing for yourself a day. This might seem small, and everyone's busy and has families and whatnot, and work obligations, but one little ritual a day can actually really help you and remind you that you're important too. Because just like the oxygen mask on the plane, you put that on yourself first, and that's really important. I think sometimes we forget that. And even a small thing, having your favorite coffee, your favorite whatever, or just like a moment to yourself can be so powerful. Coming back to basics, knowing what your basic needs are. Are you getting enough sleep? Are you getting, are you moving enough? Are you stretching? Do you need some water? Are you eating balanced meals? Are you eating enough? Just kind of checking in with those kind of basic things can be really important. And we tend to forget those when we're not necessarily in a good place. Doing something that makes you laugh. As we know, there's so much heaviness in the world from incidents that have happened the last few weeks and ongoing. Can you do something that's lighter? Can you let go of watching the news at night? Remember, what you're taking in really can stay with you. So it's important to really also take in things that are lighter and things that feel like they're less burdensome. And you can, actually feel better when you're taking them in. Let's see. Also, I like to call these pocket coping skills. So if you think about like jeans, you have 5 pockets. There's a little one in the front. And if you had a coping skill for each pocket, what would those be? And they should be things that you can take with you so you have them all the time. So an example of that is like deep breathing, really taking in inhales and then a longer exhale can really reset your nervous system. Meditations, they can be apps from your phone, grounding skills. So one of the grounding skills I love is the one: 5 things you see, 4 things you hear, 3 things you taste, 2 things you smell, 1 thing you can touch, or however you want to work that. Finding all the things in the room that are blue, noticing the texture of your chair, anything, listening to all the sounds outside, naming everything you can hear, anything like that can really help ground ourselves in the moment, especially when we're more stressed. Sometimes we have to get outside of our body. So kind of looking around at what's around you can really help us feel grounded. Kind of like thinking about a tree, what is rooted, and what kind of helps you root. Like even just putting your feet on the ground and feeling your feet on the ground can be grounding. Next slide. Talking helps. It is so important to be able to voice our feelings, our thoughts with someone that we can trust. Also, obviously, therapy, working through what you're dealing with a professional can be very powerful because that's an objective party. And sometimes we need that. Sometimes we need somebody who doesn't necessarily know us and see us all the time, but just can kind of just be a no judgment zone. And just having a safe place to sit with and reflect on things, and to maybe set some goals for yourself and kind of like sit back and understand maybe the challenges. Next slide. I think this is important. So it's so easy, right, to criticize ourselves. We get very stuck in that. But self-compassion is another skill I want to talk briefly about. Next slide. Very powerful. And the good news is most of us can build self-compassion. This is a skill. This is not necessarily something that we necessarily might have, but the good news is we can build it. And it's so important, and I think it's very misunderstood. It means treating yourself in a manner that's forgiving, that's accepting, that's caring, especially when you're struggling. And this is often the time where we tend to be the hardest on ourselves. And so this is usually the time we need it the most. We need self-compassion. It is not selfish. It's important to fill your cup. It is not self-indulgent. It means recognizing that we all struggle, and we all struggle in different ways. We don't have to compare our suffering. And it also means that, we all have flaws, but we deserve kindness and gentleness. And so just getting more curious with yourself and trying to understand areas where self-compassion might be helpful can be really powerful. And the more we can give it to ourselves, the more we can generally give it to others and be there for others. Next slide. Resilience is another, that's a wonderful word, I think. It does not mean we don't struggle. Resilience is that in the face of adversity and difficult times, we are able to work through them, that we build strength. If you think about it like a mountain, like it's obviously hard to do, but the more you climb, the higher you get, and it's difficult, but you're able to get there, and that builds self-efficacy. It doesn't mean it's not going to be stormy or stressful, but it allows you to really have coping skills in the face of stress in difficult times. The other thing I want to say is when you have a negative thought, I like this little challenge here, it's important to think 3 positive ones. Research has shown that our brain with positive thoughts is like Teflon, but with negative, it's like Velcro. So we really do need 3 positive thoughts or comments to really kind of put the negative one out of mind. Next slide. And the other thing is like sometimes it's not necessarily maybe about you struggling, maybe it's someone else. So in supporting others, it can be a lot, but sometimes there's just offering support, just being willing to sit down and listen to somebody. Most people don't, well, sometimes they do, but often they don't want a solution. They just might need to be listened to. Hopefully you can also share resources that we're sharing with you, and hopefully that can help too. So I'll turn it over to Jennifer. I'm sorry, we're a little bit late here. Dr. Doran, sorry about that. Thank you.
Not at all. Thank you. Thank you so much. So just briefly, I'm going to show you, we have a lot of information about where to find help, how to find a provider, how to find a particular type of provider. I'm going to go through it quickly in the interest of time, but everything will be available for you afterwards for reference, and really important to have and to share. And we are happy to take questions. So no one can see your questions, but the panel. So feel free to use the Q&A feature to ask a question confidentially if you would like to. So when do you seek help, right? When is the right time to go and get help, go and talk to somebody? If you think that you might be experiencing a mental health condition, if you're stressed, if it's affecting your life, right? If things aren't going well, if something just feels off, if you're hearing from other people, you don't seem like yourself, right? I think something's wrong. If symptoms or negative mood persists, it starts to really affect your life. And again, you just get that feeling that something is not right. It's a good time to seek help, to reach out, get some support. Going to therapy, this is really important. So we've talked a lot about problems, but going to therapy doesn't necessarily have to mean that you have a condition or that something is wrong. It can also be great to just learn new coping skills, make life decisions, get support, get some assistance when you're dealing with big life changes or a medical condition or, anything. It can be about growth and potential as much as it can be about, not doing well and needing help. So a really important thing to keep in mind. It's really useful to just improve your life, right? Change your life, feel better, feel more positively. So just quickly, and again, this is here for you after, there are mental health providers who do talk therapy, behavioral treatment, and there are mental health providers that do medication management and just, so we're psychologists, so we are kind of the doctoral level providers who do psychotherapy and behavioral health care. Psychiatrists do medication prescribing. It's just kind of a quick overview, but there are several disciplines and professions. So just a list here so you can see who does what. Really important, there is misinformation out there and there are people who misrepresent themselves. So make sure that you're seeing a provider who is licensed and credentialed, right? Make sure they've gone to school and they have a degree in mental health and psychology, psychiatry, social work, something like that. And they've actually had formal education and training and a degree in mental health treatment. Make sure that they have a license. You can go to the Department of Public Health and check and see if a professional is licensed regardless of their discipline, right? So see if somebody has an active license, and that's a good indication that they are a qualified professional. Just a lot of places to find help. Again, I'm not going to go through it all, but please, please, please. I know it's tough to find help right now, right? There's like New York Times cartoons about, how hard it is to find a therapist. It's true. Mental health needs are up. People are busy. It's not impossible. So be persistent and be resourceful. Professional organizations can help find referrals, especially if you're looking for referrals that need to use a specific insurance. There's national directories, our website, CPA, we have a Find a Psychologist member directory. APA has a national one. Insurance companies have in-network providers, Psychology Today, and so on. So here's a list of different professional organizations just to make it easy for you should you be interested in going that route. We also have some specialty resources. How do you find a provider who is a person of color? If you want to see a mental health professional of color, how do you find a provider who is a specialist in gender, sexual minority, LGBTQ issues, if that is something that is useful or desired? We also have resources for the AAPI community. We have a lot of culturally sensitive care resources available for different groups. We have a lot of information on how to deal with war, exposure to war in the media. Again, just before we send these out tonight, we're going to be adding some additional ones for how to deal with mass shootings, given what has happened recently. So including how to talk to children, especially about war, violence, things like that. There's a lot of great resources for parents and teachers. Sesame Street has some really great stuff. They have a whole YouTube series. They teach kids deep breathing, what to do when you're angry, how to regulate your mood. So it's simple stuff. There's also simple self-help stuff that you can find on YouTube. But again, Sesame Street Communities is a really good resource for younger kids. There's a lot of resources in Connecticut. They're all here for you. Websites, text options, phone options, options in Spanish and other languages. substance use support groups, so on, so on, so on. Again, I won't go through it all, but there really is a lot of stuff here. And Mental Health America has some screening tools. They're like just little tests you can take to see like, hey, might I be experiencing a condition? Should I talk to somebody? So they have some screening tools available as well. And our national organization, the American Psychological Association, has a lot of public education handouts about different disorders and conditions and things, and positive things like resilience. And most of them are available at least in English and Spanish as well. So that's it. It's a lot of information, a lot of resources. We hope that you found it helpful and useful, and it gives you some guidance should you or anyone in your life be looking for it. Thank you so much for joining the Connecticut Psychological Association tonight. We are really committed to helping our community and doing public education and outreach. It is Mental Health Awareness Month. We have a merchandise store if you're interested in promoting mental health. We have a lot of fun, like Mental Health Matters, talk to a psychologist, kind of things like that if you're interested. We're happy to take questions, and you can also reach us again at info@conpsych.org, and thank everyone for your time and attention tonight. We do live in challenging times, and it is possible to live a full and meaningful life and to feel better and to move forward, even in spite of some of the challenges that we face. So thank you so much, and hope everyone is well and takes care of themselves. Have a wonderful evening. Thank you.